नाम शाहिद रफीक है। मैं यहाँ यूएसए में वाशिंगटन डीसी के पास वैस्कुलर न्यूरोलॉजिस्ट हूँ और अपना मेरिट का चेयर हूँ। आई एम वेरी ऑनर्ड कि आज जो हमारे ओपनिंग स्पीकर हैं वो हमारी मेरिट की बड़ी एक्टिव मेंबर हैं और हमारे साथ फैमिली प्रैक्टिस की कॉन्फ्रेंस में और फैमिली प्रैक्टिस के जो एक अपना मेरिट ने शुरू किया पाकिस्तान के लिए, उसमें बहुत एक्टिव है। She lives in Minnesota, Minneapolis, Minnesota, and she's also the chair of Minnesota chapter of APPNA. She's a family practitioner and involved with academic activities and private practice as well. So Bushra, please introduce yourself more and start with your opening statements.
Yeah. Thank you, Shahid. Assalamu alaikum, everybody. Ramzan Mubarak. I hope Ramzan is good for all of you. Can you all hear me? बाकी सबको सुनाई दे रहा है या सिर्फ सईद भाई को नहीं सुनाई दे रहा?
भाई अपना म्यूट करते हैं, अपना आप माइक म्यूट कर दें तो फिर आपको अच्छी आवाज आएगी।
आपकी आवाज नहीं आ रही मुझे बिल्कुल भी।
आप अपने आप को म्यूट कर लें।
I can't hear you. Bushra, I can't hear you now.
We can hear you, Bushra. I can hear you clear.
So I'm a family practice physician with Fairview Health System and University of Minnesota. COVID-19 pandemic is an unprecedented global disaster in a lifetime, but hopefully we can turn it into a great opportunity by our sincere actions in serving the humanity. APPNA MERIT is trying its best with its limited resources to reach out to the community, especially to assist and educate our healthcare professionals here in USA and in Pakistan, including physicians, medical support staff, allied health professionals, and medical students. COVID-19 is not just a health disaster, but it has impacted every aspect of life, including global economy, social life, as well as mental health and emotional well-being. Despite all the negative impact we have seen, some goodness also has come out of this disaster. Humanity has connected like never before. People are reflecting on their lives and trying to find true purpose of life. Planet Earth is taking a break from all the commotion and pollution, and we can see that the nature is flourishing like never before. So those who were in denial of global warming have found a new evidence that it is a fact of life. So it's time we start paying attention to conserve the nature, recycle, stop the waste, and the waste we all create to pollute our own planet Earth, where we all live and breathe. The latest coronavirus outbreak is a disease which has affected most, if not all, countries in the world. But the magnitude of these impacts have varied a lot between countries. In some countries, it has caused a major disaster, but on the other hand, some have been very successful in limiting the spread of the disease and in preventing the deaths. There are many reasons why some countries might have been worse hit than the others. Differences in governmental policy responses may explain some of the differences. To understand which policies might be effective in controlling the outbreak, especially as countries move towards easing the restrictions, it is essential that we have a good data set on the timelining, and the stringency of the response across the world. I don't have any particular slides or data to share, but I just want to make a couple of references that I kind of found interesting. There's so much on Google and online resources now. So one reference or the resource that I would like to mention is that CGRT. It's a coronavirus government response tracker. It is published and managed by the research at the Belvatnik School of Government at the University of Oxford. The Oxford COVID-19 government response tracker systemically collects the information on several different common policy responses governments have taken, scores the stringency of such measures, and aggregates these scores in a common stringency index. Data is collected from public sources by a team of over 100 Oxford University students and staff from every part of the world. You can all kind of Google it later and look at the details. It's really interesting kind of how it kind of tracks all the things. So the government response stringency index is a composite measure based on the 9 response indicators, including school closure, workplace closures, and travel bans, rescaled to a value from 0 to 100, 100 being the strictest response. So this index simply records the number and strictness of the government policies and should not be interpreted as a scoring the appropriateness or effectiveness of a country's response. So one of the other, there's like I said, there's so many numbers and of online resources for tracking the number of reported cases of COVID-19 globally. And one of the interesting resource that I found was also its Worldometer COVID-19 data. This lists the countries and territories, and their continual regional classification is based on the United Nations GeoScheme. So USA, according to that criteria, USA is still on the top, and Pakistan is currently number 20th on the list as compared to other countries worldwide. So Pakistan is still quite high among the 212 countries that are listed in that criteria. So as the numbers are changing so rapidly, it is really hard to keep track. So Worldometer's COVID-19 is a kind of easy tool to keep track on a daily basis how the numbers are changing. So our topic of discussion is public health update on coronavirus in Pakistan. And I'm so honored to have the esteemed physicians from Pakistan on my panel today. So first of all, I'll invite Dr. SAEED AKHTER, and I'll share CV of Dr. SAEED AKHTER. He has a unique combination of background as epidemiologist and public health person, and a surgeon performing high and complex surgeries, and 2 years hands-on experience in basic lab making monoclonal, polyclonal antibodies. He graduated from SM Medical College in '83 as a best graduate with many honors and gold medals. He has done his M.P.H from Yale. He has a urology and transplant training from New York and University of Minnesota. I'm honored to share that with SAEED Bhai here. He was the chairman, Urology, Texas Tech University. He established urology at Shifa and founder of PKI, Pakistan Kidney Institute for Poor Patients. He is also founder of PKLI, Pakistan Kidney Liver Institute, Lahore, with focus on prevention of hepatitis and kidney diseases, and a kidney and liver transplant for poor patients. Currently, he is the chairman, urology and transplant surgery. He has 57 publications and more than 100 international presentations. One of the awards that he has, he has earned several awards and honors through his career. One that I would like to mention is Tamga Imtiaz, which is a Pride of Performance awarded by President of Pakistan. Thank you, SAEED Bhai, for being here, and I'll give you the mic. SAEED Bhai, you have to unmute yourself. I can't hear you.
You can't hear me?
Yeah, that's good.
You cannot hear?
Now we can hear.
You can, okay.
Yeah.
So I'm very honored and humbled by being here, and thank you so much for inviting me, Bushra. APPNA has done a tremendous job being a lifetime member, and APPNA MERIT has been a very, very active organization on the forefront of all the educational and research activities, and APPNA has been, again, me being a very integral part of APPNA relief during disasters like earthquake and floods and whatnot. And again, APPNA has come up with this mission of teaching and educating people and masses. So congratulations to you, Shahid, and our president also. I think all of us are in a very, very unique position in this time of our lives. We are in a situation that at least I don't ever think that I've ever experienced a situation like what we are in. And interesting thing is we are all together across the entire globe. It's not a earthquake in Pakistan or earthquake in Haiti or whatnot. And whereas there are a lot of challenges dealing with this pandemic, I think there are a lot of opportunities also that this pandemic is going to bring. And I think you will agree with me if I say that by the end of this pandemic, the word will be a very different word, actually. And again, I say that by the end of this pandemic, meaning being very cautiously optimistic person that is going to end, inshallah, at some point in time. But when whatever is going to happen with this pandemic, when it's going to end, how things are going to shape up, how the economies will change, how we will change, how our lives will change, how our generations will change, how the way we do businesses will change, how this is actually going to be a game changer in every possible way. It also will actually help us prioritize what our priorities are. Are we interested in making A-bombs and guns and submarines, or are we more interested in strengthening our healthcare system? And this also exposes a tremendous weakness of even those systems that we thought were very, very strong, including USA and Europe. So I think it's a time for us, of all of us, to ponder how things have evolved in the last few months and how they are going to evolve. So the first thing I think that I want to mention is I don't know about this virus. Knowing what I know, and it shows, it makes me more humble by saying that I don't know about the virus. I think we are all learning. Every day there's a new data coming. Every day there's a new. But one thing that we have learned in last 4 months is that the only way we can deal with this, for now at least, is by isolating ourselves, which means social isolation, physical isolation, etc., etc. We have no medication that really works. We have no vaccine that really works. And then let's quickly review, and I don't think I want to waste everybody's time by telling you what kind of numbers are we dealing with. Globally, we are close to reaching 5 million, and then in Pakistan, 38,000 people. So like any epidemic, when it evolves, it goes very, very slowly, and this process is extremely deceptive. So in 1999, CDC, when they were following these influenza viruses epidemics, they sort of came up with a terminology called Pandemic Interval Framework, PIF. And that actually sort of gives you how in time and space these epidemics sort of evolve. And it's divided into 6 phases. And typically the phase 1 is the investigation phase, where a virus is identified, everybody starts to talk about it. And then as the disease sort of progresses further, we go into what is called as a recognition phase, where we actually recognize that whatever this strange illness is being caused is a virus, and this is the name of the virus. And then we actually start to see the transmission. It's called initiation interval, where we start to see the transmission of the virus or whatever disease from one person to the other person. And then comes the acceleration phase. And unfortunately, in Pakistan, we are still in a very steep sort of up curve phase. And then in the life of this pandemic will come the 5th phase, which is the deceleration interval, where it will peak and then the curve will start to come down. And then the last one would be the preparation interval, where the epidemic or pandemic will sort of come to an end, and people are starting to prepare what happens post-pandemic, and what happens and they're preparing for the second wave actually. That's why it's called preparation phase, because the game is not over. So in Pakistan's perspective, I think we are still in acceleration phase, and this is a time that our number of cases from one a day to one a week to a couple of dozens a week to now we are almost reaching 1,400-1,500 cases. So as I said earlier, I'm a strong believer that we, as a healthcare person and as a person who knows a little bit of epidemiology and public health, our only way out right now has to be that we protect ourselves, and that would be through like a very strictest form of the lockdown. But then the lockdown does not come without a price, and it really paralyzes the entire economy. So when it comes to the government level, you know, one has to make a decision that, so do we continue with the epidemic or pandemic and let the people die, or do we sort of find something middle ground? And that's what I think all the governments in the world are struggling, including Pakistan government. We are lucky in a way that we are a late receiver of this ailment, because we could have been the first one, like Iran, because it came through Iran to us. And unfortunately, at that time when it came to Pakistan, again, in an epidemic, when again epidemic goes through its own phases, and when the people are just importing the case where there's no secondary spread, that is typically the best time to intervene and sort of lock those individuals, quarantine them, identify them, quarantine, test them, and quarantine them for about 4 to 3 weeks. And if we can quarantine all the incomers, that's how you actually capture a pandemic entering your country. But it's easy said than done, and it's very, very difficult. So people came through Taftan, people came through, but that's all history. And unfortunately, we were not successful. Then came the secondary phase where it started to spread from person to person like a horizontal spread. And right now, that's where we are. And typically these epidemics, as they grow, these contacts are initially traceable, and then they become to a stage where even the contacts are not traceable. And I think we are almost there, where it's such a hodgepodge of people that I don't think that now at this point in time, epidemiologically, we can actually do all the contact tracing and contain the disease. So right now, I think we are in a stage where we are still in the acceleration phase. To top it off, by all this catastrophe, I must mention that unfortunately, we are a very, very poorly disciplined nation. We don't follow the instructions, we don't follow the advice. And unfortunately, the authority that state has to use to protect its citizens from all this evil was very weak. So resultantly, like for example, in South Korea, a person, if he comes out of his home, they had such a network of people watching that SMS will come to him that you go back home unless you have a reason to come out, and that's also with the permission. And if he still does that, they will fine him $2,500. So unfortunately, in our country with such a large population, very poorly built infrastructure and healthcare system, all these things can be discussed, but I don't think they are very, very practical. So right now, I think I want to conclude by saying that I think the worst is yet to come. We need to be prepared. Now the government has actually softened the lockdown. We have not seen the ramification of that softening of the lockdown. Government had no choice but to do that because they wanted to protect the country from an economic disaster. But in my judgment, it's not a good decision. If they could have just waited another 4 weeks and persevered through that, so that the acceleration phase or acceleration interval should have turned into a deceleration interval, that could have been a better strategy. But again, that's an opinion. Obviously, government has to look at many other things. So right now, I think with no medications and all these hoax, or not hoax, but the talk about hydroxychloroquine, chloroquine, um, TB belt and malarial belt and all that stuff. I think that's all part of the history. And we are lucky that we are getting this disease late, so at least we have that information on our hand, and then the vaccines are being made. Hopefully something will come up. Just want to touch base on herd immunity. I think exposing our people and bringing the concept of herd immunity may not be very, very practical for Pakistan, especially where our elders live with us as a part of the family members. And it will be almost like a death sentence to our elders, unlike in Europe and America, where they live in nursing homes, where there's not so much mixing of the elder, and you can, in a more controlled way, protect your elders. So we have more difficult times to come, and I think we as a nation have to all unite to unite together and sort of do our role and pray for to Allah for His mercy as well. But at the same time, as a scientist, we need to come up with all the scientific tools to contain and strengthen our healthcare system. Thank you very much.
Thank you so much, Saeed Bhai. You're right. It's really, we all are learning as we go through the time frame with coronavirus. But you know, hopefully, inshallah, we make some progress and end this. And I'm really hopeful. Hopefully, it will end, inshallah.
Just want to say one thing, Bushra, quickly. That, you know, if you go back to the epidemic or pandemic of swine flu, so there came a tidal wave, came down, everybody was rejoicing, and then came the tsunami wave. It was so it came in three waves, and that was so this is something that we just need to be aware of.
Right. All right, thank you so much again. And my next presenter is Professor Iqbal Khan. He is a MD physician, F.A.C.S from England, F.A.C.S from Glasgow, Diploma Vascular Surgery in UK. He is also M.H.P.E from Netherlands. He is a professor of head of surgery since 2005, medical educator since 2007. He is teaching since 1992 till today. He has 79 publications. He is author of 6 books. His expertise are general surgery, vascular surgery, medical education, and medical ethics. He's the Dean Principal of AJKMC from 2011 to 2014. He was also Dean of F.A.S. SDMU from 2014 to 2015. And he's currently working as a Vice Chancellor of Shifa Tamir-e-Millat University since 2015. Welcome, Dr. Iqbal.
Thank you very much, Bushra. I just want to follow what Saeed Bhai said, that I just want to emphasize on the healthcare workers and the impact of this epidemic on the healthcare workers. In Pakistan, as you all know, it is a resource depleted country, but at the same time, we also don't put much efforts on the organizations of the things. And therefore, we have seen that there is a mess among the medical workers and the healthcare workers as well. But at the same time, alhamdulillah, as you see that there are, I can share a few of the, with you some of the my presentation that me. The time it's coming, I'll continue that there are more than 38,000 cases in Pakistan at the moment, and out of those, there are over 700 healthcare professionals who are infected. And the bad part of the story is that in Pakistan, the healthcare professionals, when they are infected, probably their virus load is so much that the recovery process in healthcare professionals is very, very slow. And we have lost few of our colleagues as well. But at the same time, the healthcare in Pakistan, they played a very vital role in not only in treating the people who are suffering with this infection, with the enemy, where we don't know the biology of this disease, we don't know the typical clinical presentation of the disease, And where I am working, we receive a number of COVID patients, and particularly 20 beds are allocated for 20 ICU beds are allocated for the COVID patients, almost full. But Alhamdulillah, the good part of the story is there is a organized work in this hospital. But comparing with the other places in Pakistan, we are slightly better off because of we have a very good ID department, the infection disease department, very good. And at the same time, we have over 100 ICU beds, critical beds, and therefore managing the patients slightly better. But I see as a whole in Pakistan, there is a terror among the health professionals, and it is because of the fact that they feel themselves they are insecure. And at the same time, we see there are so many social impacts are implicated on the healthcare. And this has arose a new, probably a sort of new epidemic of a new psychosocial events in Pakistan among the healthcare professionals. It's a difficult period for all the healthcare professionals because at one time, though I'm sure that the government is trying its level best to provide the PPE to the healthcare professional, but at the same time, not every healthcare professional is being protected. Those who are the frontline workers dealing with the patients, not only with the COVID patient, because we don't know the patient coming to us is a COVID positive or COVID negative, and therefore we have number of people working in different places in Pakistan, from primary care to tertiary care, but they feel themselves they are, and even then they get all the PPE, still they feel that they are not protected. And this is the unforeseen terror which we see in Pakistani. We have ample of guidelines being provided by the government and also by WHO. And I appreciate APPNA MERIT. They have been continuously guiding us in different phases of the disease. Probably we are facing a peak of this disease, and the effect of this, what has government opened now, probably we'll see in next in 2 weeks or a week's time, 10 days after that. We don't see the effect of this opening up of this lockdown currently. As you see, the numbers are increasing. They are not static. If I see only the last 24 hours, we have over 1,500 cases. I believe there are 1,580 cases. And before this, you have 2,000 cases. And it range between 1,500 to 2,000 cases, and they don't come down. So therefore, we don't know actually what is going to happen with us in next few. And the other part of the story, in Pakistani population, we have ICU bed available. So far, we are better off. The availability of beds and the number of the patients who require ICU are probably matching. But the third part of the story is the recovery from ICU patients is a very, very low percentage compared to the past. I'm not talking about Shifa, but I'm talking as a whole, that because of the fact that the people, either the patient come late, or we have not very good ICU management for these patients. And those patients who goes on ventilator, majority of these patients, they don't come out. Therefore, this is another sad part of the story in Pakistan. But apart from all these things, our people are, alhamdulillah, they are well aware that we are going to face this epidemic, and alhamdulillah, our healthcare professionals, and particularly medics, are trying their level best to come up with the with the situation. I just want to touch at the end a little bit about our prayers, religious congregations, and the obligations. We are Muslims, alhamdulillah, and we are proud of to be Muslims, and we have faith in Allah subhanahu wa ta'ala that ultimately Allah subhanahu wa ta'ala will bring out of this situation. There were a number of guidelines given by ulama, our religious scholars and clergy, but at the same time there is a lot of confusion, and this confusion is between the authorities, the governmental authorities, and our clergy. Unfortunately, our mosques, they don't follow, majority of the time they don't follow the so-called SOPs given by the government and the ulama. And at the same time, you might have seen that we have now come out on the street to demonstrate or to whatever we like. This last 10 days of Ramadan are very important. And it happened this morning, I visited 2 mosques purposefully that I need to share it with my other colleagues. They are almost full of those people who are doing itikaf. I don't think, I request my my brothers and sisters that you can do itikaf at home. And while you're in a very close contact with each other, I just want to share with you Umar bin Has, Razillah Ta'ala, the Jayyid Sahabi of Rasulullah Sallallahu Alaihi Wasallam. When they went to Syria, and there was an epidemic in Syria, and what he is instructed to his people that this epidemic is like a fire, and you need to spread around. And he asked his soldiers and the people to spread in the surrounding area and make a distance from each other so that you cannot catch the disease. This is our guidelines. These are our teaching. But unfortunately, majority of Muslims, they are unaware about our we expect that inshallah something good will be coming out of that. And but we, being an educationist, what it has given us to the opportunity to the educationists. I see that we were very poor in Pakistan in making some efforts for the online education and the education through ICT. But alhamdulillah, during the last 2 months, our students, particularly the professional students, the professional institutions like medicine, engineering, and other sciences, they have tried their level best to utilize this time. And our faculty developed different modalities and different modules so that the education part will continue. And this, alhamdulillah, has created a lot of interest among the educationists to come up with the new modality of the education as well. So this is the one part of the story. And second part of the story is that again, we have developed in Pakistan, the telemedicine is not very developed. And alhamdulillah, and therefore it's also required for our far-flung areas of Punjab, Sindh, Balochistan, and other places where we can provide them a quality care through telemedicine and through online consultations. But during this period, alhamdulillah, there are so many organizations like Pakistan Islamic Medical Association, Pakistan Medical Association, and other organizations. They made efforts to provide the consultation to the people online. And so far as I know about one organization, they have provided over 7,000 online consultation to the people in 1 month's time. This is another opportunity which opened up over the period of time. And in Shifa, we have opened the virtual clinics as well. And I think that can be replicated anywhere else. And we are ready to share our software with other people so that we could be able to develop this this system in their own places. I thank you very much. I think APPNA and Rawalpindi Medical University, I met people there, and I don't remember the names, but I was one of the main speaker in this conference, which was organized for the for the family physicians. What we can do for the future. I think we need to train our medics, paramedics, and nurses how to cope with the unforced situation. Number two, how our religion guide us, and this is one of the best methodology in our setup to educate our people how our religions, our faith guide us in different epidemics and difficult situation, and how to in these days. By this, inshallah, I will take at the end the questions as well. I thank you very much for giving me the opportunity to take part in this webinar. Thank you very much.
Thank you so much, Dr. Iqbal. So my next presenter is Dr. Nausheen Hamid. She's a member of National Assembly of Pakistan. She's a federal parliamentary secretary, National Health Services, Regulation and Coordination. She's a parliamentary standing committee on national health. She's a chairperson, SDGs Parliamentary Subcommittee, Goal 3. And she's also a graduate from Dow Medical College, 1986. Welcome, Nausheen. Thank you for coming.
Thank you so much. Being part of the present government, I would like to share some of the initiatives which the government is taking. We had the first reported case around in the last week of February. So we had almost more than a month to get prepared for this pandemic, because it started almost 40 days or 45 days earlier in other parts of the world, China and other parts of the world. So from day one, when this situation started in China, Pakistan started taking different steps. So first of all, what we were worried about is that we needed the diagnostic kits, because we knew eventually when the cases come to Pakistan, the first thing which we will need will be the diagnostic kits. So the first priority was getting hold of these diagnostic kits. And secondly, we needed the protective gears, the protective equipment. So this duty was actually then from the National Health Services, this was given over to NDMA. So NDMA was given the task for procuring the diagnostic kits, for the protective gear, and for the ventilators. So they were doing all these things for the government. They took the responsibility. Then secondly, because after the 18th amendment, the health now is a devolved subject. So keeping all the provinces on board and keeping a uniform policy was difficult. For that, then the National Coordination Committee was established. It is chaired by the Prime Minister, and all 4 provinces, the chief ministers from all 4 provinces and health ministers, they are part of that committee. So that is one platform which they meet often, and they try to discuss and they try to come to common solutions. So, but we are facing problems in that also because of the devolved subject. Provinces sometimes take their own decisions, and federal they're not many times on the same page. So now we have also created Emergency Operation Command and Control Center, which has a meeting every day at 10 o'clock, and they assess the situation and the steps which are needed to be taken, because evolving situation requires different steps every day. So policies are being made over there, and then they are presented to the National Coordination Committee. Presently, Pakistan, I think, has got the most comprehensive health screening mechanism in Pakistan at all the major airports and other port of entries. So whenever a flight lands in Pakistan, after being screened by the central health establishment and taking the health declaration forms, the local administration takes over, and they transport them all to different designated hotels in the respected cities. And over there, then they are allowed to, they are expected to stay for 2 days. Their corona test is taken, and only after their corona tests are cleared, they are allowed to leave and go to their homes. So this is one thing which we are doing. Then, we are catching many patients coming from different countries. So now another, Pakistan has also, we have designated about 200 hospitals for isolation all over the country. And one good thing about the PPEs is that Pakistan, one thing has come out of this, that now we are able to manufacture our own PPEs. We are able to manufacture the N95 masks, which were in real shortage in the early days. And because of that, I think many healthcare professionals, they suffered because we were not able to provide enough protective gear to them, as was being mentioned before me also. When this in March, we had only 4 laboratories to diagnose this COVID-19, but now more than 70 laboratories are working in Pakistan for diagnosing this COVID-19. Now, different quarantine facilities have also been established in different provinces, and I think they are also functioning, and people are over there, and they are being looked after. About the hospitals I was mentioning, one unfortunate thing is that in government hospitals, where they have designated these hospitals for corona patients, the general medical problems are suffering. In PKLI, dialysis has been stopped. Many patients are suffering because of that. There's a hospital by the name of NIRM, National Institute of Rehabilitation Medicine in Islamabad, where orthopedic surgeries were being done for free for the lower socioeconomic people. That has been stopped because that hospital has been converted into corona wards. So I think these things, people are suffering. Shaukat Khanam, the biggest cancer hospital in Pakistan, that was also been designated for corona patients and cancer patients. Only, I think, the breast cancer and the non-Hodgkin's lymphoma is being treated. The rest of the OPDs, and they have been closed down. So these are issues that the general medical conditions are suffering. Then Pakistan has also established Corona Statistics Digital Dashboard, which provides real-time comparison of COVID-19 pandemic between the world and Pakistan. And also we have got a centralized case-based information reporting system for COVID-19. And the government has also established this, as was being mentioned by Professor Mohammed Iqbal, that telehealth portal, which is connecting the volunteer doctors to the people with COVID symptoms. One more thing, that the healthcare professionals, yesterday, the government of Pakistan launched a training program for which will cover more than 1 lakh healthcare professionals, and they will be given training in using of this protective equipment, where to use, how to use, and all these, and ISPR, Pakistan has released a detailed documentary on this, and these healthcare professionals will be treated how to deal with this corona patients and what measures they have to take. So these things were the general steps which are being taken in relation to the COVID, but I would just like to mention the economical condition of Pakistan also, because much is being talked about the lockdowns. But actually this lockdown, we had to ease it out, because now the small businessmen were on the roads protesting, people were on the road protesting, and law and order situation, it seemed that it will be compromised. If we don't open up these economic activities, the law and order situation was being compromised, because incidences of snatching, shooting outside ATMs were reported, and people were really suffering also. And I think this was something which government, this decision which government had to take. But unfortunately, as Dr. Saab was mentioning before me, Dr. Saeed, the people are not disciplined. And the main issue which we are facing is that people are not cooperating. The government has issued SOPs, the government has issued instructions. And I think at this time, the media, especially the government channels, they are functioning 24/7 to create awareness about COVID-19. They are, in fact, the title of the PTV program is Apna Ghar Apni Jannat, Mehfoos Ghar Mehfoos Jannat, something like this, that they are doing so much to create awareness, but unfortunately, I think the people, they still do not understand the importance of staying at home and but they're protecting themselves. So lastly, I would just mention one thing which I, yesterday WHO mentioned, and I would like the expert opinion of some of our professionals who are here, that WHO was predicting that this pandemic will be eventually converted into an endemic, and we will have to face it. So I would like someone to comment on this, some professional opinion for this. Thank you.
Thank you very much, Nausheen, for updating us. You're right, there are some real issues, and really the best way to tackle really is isolation and taking responsibilities. Saeed Bhai, do you want to take that question from Nausheen and answer the response to the question she's asked? You have to unmute yourself. Saeed Bhai, you have to unmute. You're still muted.
Unmute now.
Yeah, that's good.
Okay. So I think as we are trying to understand the biological behavior of the virus, it is becoming very, very obvious that this is something that is going to last longer than what we had thought originally. Now, if you go back into the history and look at the epidemic of MERS and SARS, these two similar viruses, they came, they lasted, they were very aggressive, and then they sort of died down. Here, the problem is that we don't know much about this virus. It seems like it keeps changing its face. So the antibodies it's making today may not be good enough. So it's going to somehow follow the pattern of like influenza that we eventually had learned to live with and design the mathematical model to predict what strain of influenza will come and prepare vaccine ahead of time. So I think there's no question that this is not going to go away, whether we have to live with it or not. I think the time will tell whether it will become an endemic. And when they say it will become endemic means it will be so prevalent in our society that, you know, we just have no choice but to live with it. So I think time will tell that, but I think we are heading in that direction. And sooner we are prepared for that, better off we will.
Thank you, Saeed Bhai. Yeah, I am a believer in dua and dawa both. So certainly हमें दुआ भी करनी चाहिए. ये रमज़ान का महीना है. So I think we should really, pray to God कि इंशाल्लाह ताला ये over हो जाए.
Can I say just one sentence, that the complex nature of the pathology which is caused by this virus is not fully understood. Now, the concept which was in the beginning of the disease is now changing up, and probably the new concepts and the new facts are coming up about the disease itself. Until and unless we know how the disease causes what, is very difficult to understand the pathophysiology of this disease, one thing. And secondly, I think the one very important message we should convey today to every one of us, being professional or non-professional, that we should have some discipline in our life. We must have some discipline. Those people who are safe from the virus are only those people who are disciplined in their life. We should learn, and we must learn what discipline is about. Thank you very much.
Thank you so much. So, we are kind of getting closer towards the end. So we have some participants who have some questions, and sound like most of the questions were really answered with your presentations. People were raising questions about role of government and parliament, concerning the COVID, and Nausheen, I think you covered that area very well. एक जो issue है जो I think मेरे mind में भी आ रहा था, और I've seen some question raising कि certainly lockdown जो है, it is a struggle in Pakistan, और especially रमज़ान में मस्जिदों को खुला रखना, it is certainly heartbreaking कि हम सब ये चीज़ feel कर रहे हैं कि मस्जिदें बंद हो रही हैं या ये, लेकिन ये हमारे दीन में भी इस quarantine का concept exist करता है. So इसलिए I think we have to kind of keep our emotions control and not get too emotional about it, because this is a serious threat. It's not a joke. especially because we have seen what has happened in US. It is unbelievable, you know, it is unbelievable. So alhamdulillah, I think Pakistan is still doing better, but it's still, like I said, it's still on the 20th in the list of other countries. And sometime I believe that, you know, because testing 100% नहीं हो रही है और लोग पास दफा रिपोर्ट नहीं करते, unfortunately mostly आते पाकिस्तान में we've been lucky that at least they've been more milder cases and we're not seeing as many deaths, लेकिन ये सब real है. So इसलिए I think we have to understand that this is serious. We should not, you know, ignore that. So इसलिए I think, you know, government is doing a lot of actions and मस्जिदों को certainly रोज आ रहे हैं, लेकिन as a human being I think ये हमारी अपनी civic responsibility है, हर इंसान की अल्लाह ताला का हुक्म है कि हम अपना ख्याल रखें और हम अपनी community का भी ख्याल रखें. अगर हम precautions नहीं ले रहे हैं उससे हमारी community भी affect हो रही है. So इसलिए I think हमको सबको ये बात याद रखनी चाहिए. Like I said, ये COVID is really testing our deen and our emotional well-being, our economically. It has impact every aspect of life. A lot of people have raised question about mental health issue, which is a serious issue. So I'm curious that you know, what is the best approach, you know, and there have been some questions about, you know, how we take care of other chronic illnesses, you know, the patients with other health issues. So COVID is not the only problem. We're still seeing a lot of heart attacks and strokes, and people are ignoring the symptoms. They're not going to the hospitals because, unko, you know, they're afraid that, you know, you're going to catch the infection, whatever. So just in US, we are doing, we are really taking it very seriously. We're not, clinics are not open for routine patients like we always do. So we are doing a lot of telemedicine, and we basically do phone visits, video visits. So I know, and Dr. Iqbal, you touched a little bit on that too, but I'm hoping that technology is available. I think Pakistan mein har shakhs ke haath mein ek phone hai, and people have smartphones. So, you know, the way we do it, basically, we have this app, people like we're using MVAL and Doximity through my University of Minnesota, but other, you know, they have their different technologies they're using. So I think we should use that, and phone visits are easily doable. We can do video visits. People har waqt FaceTime chat karte rehte hain. So hospitals should have come up with some mechanism so people can still be consulted rather than having a big OPD where patients are lined up and bunch of people are sitting there and increasing the risk. So ye zaruri hai ki ye kare, government should participate in that too, and I think hospitals should take a lead on that and create some system so people feel like they can still consult a doctor, you know. So
I have a
Saeed bhai,
comment to make
aapne
about
kuch
that.
mention kiya tha previously bhi ke
there's a guy named Ed Young. He wrote a very nice article in this famous The Atlantic Journal. And he predicted that after this pandemic, there will be a big pandemic of psychological problems. और इसकी जो आसान तरीन मिसाल मैं अपने मल्टीपल टॉक शोज में भी कर चुका हूँ, वो ये है कि फ़र्ज़ किया कि मैं इन प्रिंसिपल्स को फॉलो नहीं कर रहा, सोशली रिस्पॉन्सिबल नहीं हूँ, and my old mother dies because I bring the virus to her. So I will never be able to forgive myself. मतलब ये बीमारी ऐसी नहीं है कि एक तो बीमारी है जैसे कॉलरा की बीमारी है, ठीक है, होगी, इसका जो
हमारी अखलाकी जिम्मेदारी भी है,
इसका स्कार जो है वो बहुत डीप होगा. That's how I warn people, for God's sake, if you really care about your parents, isolate yourselves, social distancing करो. तो ये इसके लिए हमें बिल्कुल ज़हनी तौर पे तैयार करना चाहिए, और हेल्थ केयर प्रोफेशनल्स के तौर पे हमें इसको जो हमें वो करते रहना चाहिए, लोगों को बताने की ज़रूरत है कि हमें how we are going to actually deal with it. It's going to be a major issue once this pandemic is over.
Right.
We need to prepare for that today.
Couple of other comments that I wanted to make, you know, mental health ka or media ka, people have asked questions, what role they can play. So I think media is always very effective reaching out with people, especially to mental health ke patients hote hain, and mental health patients, mostly they need really counseling. So I think media can help with that, you know, and alhamdulillah, हमारा दीन हमें ये भी सिखाता है कि हमारा faith is a very big, play a very big role in our mental well-being. So media can do some shows about it, you know, just the counselors, हमारे जो मौलवी हज़रात हैं और जो हमारे दीनी scholars हैं, you know, they are all really want to be in the mosque, you know, but they can use the media, they can use the Facebook to reach out to people with the mental health issues and addressing some of the major concerns that are happening in the community. कि किस तरीके से उनको counseling कर सकते हैं, you know, अगर even people don't have one-to-one services, I think you should focus on that a little bit. दूसरा ये है कि research वगैरह जो है आजकल, I know Pakistan has been really quite actively working in some of those areas. So inshallah ta'ala, we hope that we all do that, and people really should focus their energy working behind the force, use your talent, use your जो भी आपके अंदर सलाहियतें हैं उनको positive way में use करें, go out, reach out to the community, help people in need. So I think those things really give us peace of mind. But like said, I think it is our utmost responsibility कि सिर्फ हमें अपने लिए नहीं सोचना, हमें दूसरों के लिए भी सोचना है. तो हम अगर you feel comfortable कि भी मैं ठीक हूँ, मैं बाहर जा सकता हूँ, सब कुछ कर सकता हूँ, but then it's an attitude. तो जब 2-4 लोग बाहर जाते हैं, हर कोई कहता है मैं भी जा सकता हूँ, तो इस तरह से भी create an environment जिसमें फिर unsafe practices होती हैं. So
Bushra, can I say as you rightly mentioned that there is energy behind every, so this energy is probably academia and research. And I invite everyone who is working in medical profession that to come up with the research in this. It's a good opportunity. So I have launched 6 projects only on the socio-economical impact and the psychological implications of this COVID on the healthcare workers on one end and on the patients on the other end. So please, I invite everyone that those who are the academician, please come up with the research project, and it's a good opportunity to support the government by few facts which we can gather over the period of time, and then we can come up with the solution of our problems. And secondly, I will request media personnel and those who have access to that, they don't come up with the जो बहुत ज़्यादा खौफ की फिजा हमने पैदा कर दी है मुल्क के अंदर, इसने लोगों का बहुत ज़्यादा एक मरीज बना दिया है. And we should be very, very optimistic inshallah for the future, and we should not create terror among the people that this will happen. Though majority of our people, they are not being affected, but those who matter, the educated lot and the intelligentsia, they are very badly affected by this terror. So I will request everyone, और एक गवर्नमेंट से डॉक्टर नौशीन से मैं रिक्वेस्ट करूंगा कि they should launch a few apps for the different patients suffering from chronic diseases, particularly the people suffering from diabetes, hypertension, ischemic heart disease, and chronic giant disease and liver and kidney disease. They are really suffering this period, as you mentioned in your presentation as well. We request you to create apps. These smartphones are available with everyone nowadays, and if we create few apps and it should be connected with the professionals, inshallah, we could be able to serve our community without any much losses, inshallah. Thank you very much.
Thank you so much.
एक चीज मैं बुशरा और कहना चाहता हूँ. We lost a doctor where he was in an ambulance and they were driving from place to place to find a ventilator. तो मैं नौशीन से कहूँगा कि अगर वो काइंडली इसको, मैंने पहले भी ये रिक्वेस्ट की थी कि एक सेंट्रल ऐप होनी चाहिए जो कि डैशबोर्ड की फॉर्म में हेल्थ प्रोफेशनल्स को, एम्बुलेंस ड्राइवर्स को और हॉस्पिटल्स को अवेलेबल होना चाहिए, जिसमें लाइव डेटा होना चाहिए कि किस अस्पताल में कितने बेड्स हैं, कोविड के कितने बेड्स हैं, कितने खाली हैं, कितने भरे हुए हैं, कितने वेंटिलेटर्स हैं, कितने खाली हैं, कितने भरे हुए हैं. और फिर कोई कम्युनिकेशन का निज़ाम बनाना चाहिए ड्राइवर्स का और हॉस्पिटल्स का, ताकि वो इस तरह से लोगों की जाने जाएं.
Welcome. Now, I know we are all anxiously waiting to have this lockdown ended so we can go back to our routine, social life, our businesses, and normal work routine. And I hope that we all come out as a better person in every aspect of life and behave as a responsible citizen so we can continue to live a quality of life. Although one very important thing that we have to understand, the infectivity potential of the COVID and other pathogens as the country prepares to open. We all are talking about a threat of second wave. So this is serious. I just wanted to mention that the world leaders and the public health experts are really poised to spend the coming months over years obsessed with the variable known as R0. So R0 represents the number of new infections estimated to stem from a single case. So in other words, if R0 is 2.5, then one person with the disease expected to infect on average 2.5 others. So R0 1 suggests that the number of cases is shrinking, possibly allowing societies to open back up. But R0 above 1 indicates that the number of cases are growing, perhaps necessitating the renewal lockdown or the measure. So the better we practice our own behaviors, I think the better chances we have to bring this lockdown to the end. The question is really, what will be our new normal feel like after the pandemic is over? For many, the fear may linger on long after the pandemic is over. For many, it may bring a new sense of community and more meaningful life. So I hope that this all moves in the right direction, but it really requires that we all take responsibility and doing our part as a law-abiding citizen, as a akhlaq ke basis pe hamare how we behave in that. So I think that concludes our session, and I really appreciate all of you coming on the panel today. I am really honored to be part of the APPNA MERIT team, and APPNA MERIT team has done lots of webinars on different issues. Today, our main topic was really primarily just focusing on general health from a primary care aspect point of view, but they have some specialty questions that have been answered. I know a lot of people were talking about different medications and vaccinations and all of that, and APPNA MERIT has done a lot of different specific webinars on specific issues. So please log in and look at those, and hopefully you'll find the answers. But again, thank you very much, everybody. Thank you, Shahid and Waleed, for coordinating all this to make it possible. And I wish you a happy Ramzan and hopefully happy Eid soon, inshallah ta'ala, and take care of yourselves.
Thank you so much. I really appreciate it.
Allah Hafiz.
Hafiz.